Imagine sitting quietly in your favorite chair, maybe with a cup of tea, when suddenly your head feels woozy and your heart starts racing. You grab a blood pressure monitor, and the numbers on the screen make your stomach drop. For many people over 60, this kind of surprise is terrifyingly familiar. High blood pressure, also called hypertension, often sneaks up without clear warning signs, yet it damages the heart, the brain, and the kidneys over time. But here is the hopeful truth. Research shows that small, practical habits can dramatically lower blood pressure and reduce risk, often with effects comparable to medications. This video will walk you through 5 simple, science-backed habits that are easy to adopt and powerful in their effects. You do not need expensive supplements or complicated treatments. You need consistent steps that nourish your body and calm your nervous system. These habits work together like teammates, each one supporting the others, and together they reduce stress on your blood vessels, improve circulation, and help your body regulate pressure naturally. I will explain each habit clearly, show you how to prepare and practice it, and give tips to get maximum benefits without overwhelming change. You will hear about sleep strategies that allow your body to reset, gentle exercises that strengthen your heart, dietary changes that lower pressure, breathing and stress skills that calm your nervous system, and a remarkable drink backed by studies that helps your blood vessels relax. Stay with me to the end, because the number one habit involves a drink you can easily make at home, and clinical trials show it can lower blood pressure substantially, sometimes within hours. That drink is surprisingly common in kitchens, and the science behind it is both simple and convincing, so don't miss the reveal at the end of this video. I will break down the science into simple actions you can do today without special equipment. You will learn practical tweaks that fit into daily life and explanations that make sense even if you are new to health science. Think of this as a toolbox, small tools that together build strong protection. By the end, you will have a clear plan that you can start right away and adjust to your needs. Let's start by understanding how your body manages blood pressure and why gentle habits make a big difference. I will also explain any technical terms simply so nothing is confusing. Stick with me and you will find the path to steadier blood pressure is both reachable and rewarding. Number 5. Prioritize quality sleep to balance your blood pressure. Sleep is not merely rest. It is an active, restorative state when your body repairs tissues, balances hormones, and regulates blood pressure, a function that becomes increasingly important after 60. As you age, changes in circadian rhythm and sleep architecture make deep, restorative sleep less common, and factors like pain, medications, or sleep apnea can fragment the night, leaving your nervous system stirred and primed for stress. When sleep is poor, your body produces higher levels of cortisol and adrenaline, known as stress hormones, and these narrow blood vessels and raise heart rate, which means higher blood pressure over time. Clinical studies link chronic short or disrupted sleep to increased risk of hypertension, which makes improving sleep a foundational habit for managing blood pressure naturally. Start by treating your bedroom as a sleep sanctuary. Make it cool, pitch dark, and quiet, and remove bright screens at least an hour before bed. Try to go to bed and wake at consistent times each day, including weekends, because your internal clock responds well to routine, improving both the timing and quality of sleep. Practice a calming pre-sleep ritual like reading, gentle stretching, or a brief guided relaxation exercise to shift your nervous system out of fight or flight into rest and repair. Avoid heavy meals and caffeine late in the day, and if you drink alcohol, limit it because it fragments sleep later in the night. If snoring or daytime sleepiness is common, consult a healthcare provider about possible sleep apnea. Natural supports include a cup of warm chamomile tea about 30 minutes before bed, which can help settle nerves without next-day grogginess, and light exposure during the day, especially morning sunlight, to strengthen your circadian rhythm. Gentle physical activity earlier in the day helps too, as exercise promotes deeper sleep, but avoid vigorous workouts close to bedtime. Keep naps short and early, no longer than 20 to 30 minutes, to avoid interfering with nighttime sleep. Over time, consistent sleep improvements allow your autonomic nervous system to downshift overnight, lowering resting heart rate and reducing the baseline stress on your blood vessels, which supports healthier blood pressure readings. Make sleep a non-negotiable part of your routine and you will see benefits in blood pressure and energy. Think about sleep as part of your health prescription, equal in importance to diet and exercise. Small improvements stacked nightly create large differences in months, not years. If insomnia persists, speak with your healthcare provider about safe short-term options while building long-term habits. Consistent sleep reduces daytime fatigue, supporting better decision-making around food and movement. Pay attention to medications that might interfere with sleep and discuss alternatives with your prescriber. Weighted blankets or a comfortable pillow may help you relax and stay asleep more consistently. Avoid clock watching when you wake up at night because it increases anxiety and makes it harder to return to sleep. Number 4. Move more with gentle daily exercise to strengthen your heart. Physical activity strengthens the heart muscle, improves circulation, and helps blood vessels stay elastic, which all play direct roles in lowering blood pressure, especially in people over 60. Many assume exercise requires intense training, but for this age group, gentle, steady movement that becomes part of daily life yields substantial benefits while reducing risk of injury. Walking briskly for 30 minutes most days, swimming, cycling, or participating in low-impact aerobics increase cardiac output in a steady manner, improving how your heart and vessels respond to stress. Exercise stimulates the release of nitric oxide and other signaling molecules that dilate blood vessels, and it also helps with weight control, which reduces the workload on your heart. If joints or balance are a concern, water exercises and chair-based routines provide cardiovascular benefit without heavy strain, offering a safe path to regular activity. Begin slowly and build up. Even short bouts of movement scattered through the day add up to meaningful totals and reduce long periods of sitting that stiffen blood vessels. A warm-up before activity and a cool down afterward reduce the chance of dizziness or injury and improve recovery, and paying attention to your perceived exertion, where you remain able to speak but feel challenged, keeps you in the moderate zone that most benefits cardiovascular health. Strength training twice a week with light weights or resistance bands supports muscle mass and metabolic health, which helps regulate blood pressure and insulin sensitivity. Turn movement into social time by walking with a friend, joining classes, or finding family members who will make activity a shared routine, because social accountability greatly increases adherence. Track your progress modestly using a simple step counter or calendar to celebrate small gains. Incremental improvements lead to lasting habits. Listen to your body and consult your physician if new symptoms arise, particularly chest discomfort, severe shortness of breath, or fainting, as these require immediate medical attention. Over weeks and months, consistent moderate exercise lowers resting heart rate and blood pressure, increases stamina, and supports better sleep, creating positive feedback loops for health. Keep moving, and your heart will become stronger year by year. Make exercise enjoyable by choosing activities that fit your rhythm and preferences. If weather or mobility limit outdoor movement, try indoor walking paths or simple home routines that maintain heart rate. Consider a physical therapist visit to design a safe program tailored to chronic pain or orthopedic concerns. Even gardening and household chores count toward movement and contribute to cardiovascular benefits. Regular activity improves circulation and reduces arterial stiffness over time, helping blood pressure control. If you have a pacemaker or recent cardiac events, get clearance from your cardiologist before starting a new routine. Number 3. Adopt a heart-healthy diet rich in potassium and nitrates. Food is one of the most controllable and powerful levers for blood pressure and dietary patterns. Designed to support cardiovascular health, produce measurable reductions in blood pressure in many clinical trials. The DASH diet, developed specifically to stop hypertension, emphasizes vegetables, fruits, whole grains, lean proteins, and low-fat dairy, while limiting sodium, processed foods, and saturated fats, and it is consistently recommended by cardiologists. Potassium-rich foods such as bananas, sweet potatoes, beans, and spinach help the kidneys excrete excess sodium, lowering the volume of fluid in the circulation and reducing pressure on artery walls. In practical terms, preparing meals around colorful vegetables, adding a serving of legumes, choosing grilled or baked protein, and selecting whole grains like brown rice or quinoa creates a satisfying plate that supports healthy pressure. Limit sugary drinks and refined carbohydrates, because high blood sugar and insulin resistance are linked to higher blood pressure and metabolic stress. Hydration is essential. Drink enough water each day to help the kidneys function well and to assist sodium excretion. Meal timing and portion control also matter, so avoid overeating late at night and aim for balanced portions that maintain a healthy weight. If you prefer convenience, choose frozen vegetables without added sauces and prepare batches of healthy meals to reheat, which helps you avoid impulse choices that may be high in sodium and unhealthy fats. Over time, these shifts reduce arterial stiffness and systemic inflammation, support weight loss, and lower blood pressure numbers, giving you a nutritional path to better cardiovascular health. If weight loss is a goal, focus on gradual, steady changes rather than rapid dieting that is hard to sustain. Supplements are sometimes helpful, but whole foods provide a broader range of nutrients and fiber that support long-term health. Check with your doctor before starting any supplement if you have medical conditions or take medications. Number 2. Practice mindful breathing and stress reduction daily. Chronic stress is a hidden driver of high blood pressure because it keeps your nervous system in sympathetic overdrive, the fight-or-flight mode, which elevates heart rate and constricts blood vessels over long periods. Mindful breathing is a quick, evidence-based practice that activates the parasympathetic nervous system, the rest and digest branch, causing heart rate and blood pressure to fall and promoting a state of calm. Begin with just 5 minutes twice a day, sitting comfortably, inhaling slowly through your nose for a count of 4, holding briefly, and exhaling longer through your mouth for a count of 6 to 8, which emphasizes the exhale and signals relaxation. Combine breathing with guided meditations, progressive muscle relaxation, or gentle stretching to amplify the effect and tailor the practice to your preferences and mobility. Research shows that regular mindfulness and breath work reduce markers of stress and can lower systolic blood pressure significantly over weeks, with benefits that add to those from exercise and diet. Create a consistent cue to practice, such as after brushing your teeth in the morning and again before bed, so breathing becomes an automatic habit rather than a special task. Addressing sources of chronic stress like difficult conversations, financial worries, or caregiving burdens is equally important. Consider integrating calming activities you enjoy, such as gardening, gentle crafts, or listening to music, which produce relaxation and contribute indirectly to lower blood pressure by improving mood and restoring energy. Additionally, maintaining social connections and seeking laughter and light moments reduces stress hormones and fortifies resilience, both beneficial for heart health. Keep the practice simple, gentle, and consistent, and you will find stress responses soften and baseline blood pressure improves. If sitting for long periods is unavoidable, set a timer to stand and breathe deeply for a minute every hour. Mindful breathing can be paired with walking to create a moving meditation that reduces stress and boosts circulation. Stress reduction is not a luxury, but a medical tool that protects your heart and brain as you age. Consider a local community class or online guided session to establish routine and learn techniques properly. Number 1. Drink beetroot juice daily for powerful blood pressure control. Beetroot juice has emerged from multiple clinical trials as one of the most effective natural strategies for lowering blood pressure, and its mechanism is well understood. Dietary nitrates are converted by oral bacteria into nitrites and then into nitric oxide, a signaling molecule that relaxes and dilates blood vessels. Nitric oxide reduces arterial resistance, improves blood flow, and lowers both systolic and diastolic blood pressure, sometimes within hours of consumption, and studies show the effect can last for many hours, making daily intake practical for ongoing management. To prepare beetroot juice at home, use fresh beets, wash and peel them, then run them through a juicer or blend with a small amount of water and strain for a smoother texture. And you may add lemon or a small piece of ginger for flavor and additional cardiovascular benefits. If you take blood pressure medications, discuss beetroot juice with your doctor first, because the combination may lower pressure more than expected and require medication adjustment. Beets can cause pink or red urine and stool in some people, a harmless effect called beeturia, but always report any unusual symptoms to your healthcare team. To maximize benefits, drink beetroot juice on an empty stomach or before meals to enhance nitrate absorption, and pair it with the other habits discussed here, because exercise and a potassium-rich diet amplify the ability of nitric oxide to improve vascular function. Over weeks of regular use, many people experience consistent reductions in blood pressure and improvements in stamina and exercise tolerance, which further supports heart health through increased activity. Rotate juices by including other nitrate-rich vegetables so you do not get bored and your diet remains varied. Be mindful of sugar content when mixing with fruit juice. Prefer water or lemon to keep calories and sugars low. Consult your pharmacist about possible interactions between beet supplements and other medicines. Make beetroot juice a daily ritual, and you may find it becomes your most reliable natural ally in blood pressure control. Thank you for watching and taking time to invest in your health. Controlling blood pressure naturally is about steady habits that add up, not quick fixes, and the 5 practices we covered work together to support your heart and overall well-being. Prioritize sleep so your body can reset. Move daily with gentle exercise to strengthen circulation. Always consult your healthcare provider, especially if you are on medication or have complex medical conditions, before making big changes, and keep them in the loop as you adopt new routines. If this video helped you, please subscribe and hit the notification bell so you will not miss future tips for healthy living after 60. Share the video with family members or friends who might benefit, and drop a comment with your questions or experiences so we can learn together.